Everyone, that breaking news, New York drops the booster mandate for healthcare workers.
The deadline to receive a booster was this coming Monday, putting thousands of healthcare workers at risk of losing their jobs. But now that worry is over as the state has ended the requirement. Amel Elhel joins us live from Rochester with more on this. Amel.
Adam, Teresa, this news comes as a relief to hospital systems across the state. And according to state data, hospital systems have been struggling with their employee booster rates, and the Finger Lakes region was no exception. Until today, New York State healthcare workers were once again at risk of losing their jobs. A state health department directive mandated all employees get their booster shot by February 21st. But today, that requirement was dropped. Data provided by the state shows just over half of employees at Unity Hospital are boosted.
I have gotten all 3 of my vaccines, and if there's a 4th, I will get my 4th.
Tabitha Malevich is a nurse at Unity Hospital and says the last 2 years have been nothing short of exhausting, and adding another mandate wasn't helping. Unity wasn't the only system struggling with booster rates. Strong, Rochester General, and Highland Hospital are all under 70% boosted.
I feel strongly that vaccines are important, but I feel that it is a personal choice.
Now that the mandate has been dropped, healthcare systems don't have to worry about hemorrhaging a surplus of staff, considering booster rates across the board were relatively low.
I don't feel like the government should push the fact for it to be mandated. It's not mandated for the entire public. It's only mandated for healthcare professionals. And I find that to be wrong. You know, we work in a society where, you know, we fight for who we are and everything that we work so hard to be, and it just kind of seems like we're all kind of getting pushed to the side.
Malevich says on top of an already stressful pandemic, these mandates simply added too much pressure.
The exhaustion of working through this nonstop pace, this nonstop pandemic, this nonstop push from our hospitals to get better, be faster, work harder.
The Department of Health says this decision was made to avoid potential staffing issues and give workers more time to get the booster shot. For now, we're live in Rochester. Amel Elhel, News 8.
Amel, thank you. The DOH also reports 75% of healthcare workers have received or were willing to get the shot. Considering that data, the agency says they're working to expand access for healthcare workers.